Hello, my name is Denise Lugo. I did my signature assignment on mental health in children. I will be presenting a project about helping children and teens with anxiety and depression. Mental health problems in children are a big and growing issue. Anxiety and depression are very common and rates have gone up, especially after COVID 19. Untreated problems can affect school, friendships, emotions, and even increase the risk of substance use or suicide. Nurses in pediatric clinics and schools often see kids first. This means nurses can help spot problems early and get kids the help they need. Even though we know anxiety and depression are common, many children are not getting help. Problems can include inconsistent screening, short appointment times, lack of standard tools, or even nurses not trained enough in mental health. Because of these issues, many kids don't get help early, which can make problems worse. The goal of this project is to improve how we find and manage anxiety and depression in children and teens. We do this by using routine mental health screenings with trusted tools. This helps nurses spot problems sooner and refer kids for help. So, with that being said, this evidence based practice project aims to improve early identification and referral through routine mental health screening. So, moving on to background and rationale. About 1 in 5 children have anxiety or depression symptoms. Also, untreated problems can lead to ER visits, can lead to more ER visits, school problems, social struggles, and higher suicidal risk. Guidelines recommended screening all teens, screening all teens for depression and anxiety. Tools like the PHQ-9A or the GAD-7 are reliable and easy to use. Many clinics still don't screen constantly because of unclear referral paths, limited resources, and nurse confidence issues. So, consistent screening and limited nurse training highlight the need for a more structured, evidence based practice initiative. So, moving on to the project objectives, these will include for the first one would be screen kids routinely routinely for 12 weeks. The second one includes increased identification of anxiety and depression by 25%. The third one includes ensure 90% of kids who screen positive get follow ups within 2 weeks. And lastly, the fourth one includes to improve nurses' knowledge and confidence about mental health screening. So, moving forward to the methodology, which is a project design which uses quality improvement and evidence based practice methods. Um, in this case, quality improvement approach with pre and post intervention designed to translate evidence into practice and evaluate care processes and patient outcomes. The evaluation method would use things like chart audits, screening logs, referral tracking, and nurse surveys to assess screening completion, identification, follow up, and confidence. And that is important to maintain confidentiality, obtain consent, and ensure screening supports not replacements and clinical judgment. So to put those two together, it would be to check charts and logs to see screening and referrals. The second one would be surveys to measure nurse confidence before and after. And lastly, ethical considerations to keep patients' information private, get consent, and use clinical judgment. Moving on to expected outcomes and implications. In this case, it would be for more early identification and for anxiety and depression. Also, better referral and follow up rates. Also, to increase nurse confidence again, and lastly, overall for kids to have better emotional, social, and academical outcomes. So, to conclude, this project helps fill a gap in pediatric mental health care. Routine screenings empower nurses to spot problems early and get children help faster. By using evidence based tools, we can improve outcomes and support and well being of children and teens. Thank you.